13. A nurse is working in the emergency department when a major incident is declared. What initial action does she take? Choose the correct answer. A. The nurse stops patients coming in. B. The nurse stops treating patients. C. The nurse calls home. D. The nurse moves patients out of the department. Emergency department major incident. In such a situation, the nurse's initial action should be to follow the emergency department's established policies and procedures for managing a major incident, which may include, the nurse moves patients out of the department. 14. A person who is displaying signs of stress, anxiety and sleeplessness can be encouraged to seek help from where? A. Emergency department. B. 111 service. C. A walk-in center. D. General practitioner. The answer is D. General practitioner. A person who is displaying signs of stress, anxiety, and sleeplessness should be encouraged to seek help from a general practitioner or primary care physician first. A general practitioner can assess the person's symptoms and determine if they require further evaluation or treatment from a specialist or if the symptoms can be managed with lifestyle changes, therapy, or medication. While the emergency department may be appropriate in cases of severe mental health crises, such as suicidal thoughts or psychosis, it is generally not the first point of contact for people experiencing stress, anxiety, and sleeplessness. The 111 service or a walk-in center may also provide initial advice or referral, but they are not a substitute for a medical assessment by a qualified healthcare professional. 15. Spinal fracture patient. How will you ensure airway? A. Jaw thrust. B. Head tilt. C. Open mouth. D. Chin lift. The correct answer is a jaw thrust. If you encounter a patient with a spinal fracture, it is important to approach the airway with caution and utilize techniques that minimize movement of the cervical spine. Therefore, the best option for ensuring airway in a patient with a spinal fracture is a modified jaw thrust maneuver. 16. After an audit round, the manager tells a nurse about the outcome and possible development suggested by the team members. What action will the nurse take? A. Accept and keep the report in a file for reference purpose. B. Thank the manager and tell her that the suggested action will be looked into in due course. C. Plan how to meet with the manager to discuss the solution. Manager's audit feedback. In this scenario, the manager has 17. Abbey pain scale is used for patients. A. Birth to 1 year. B. Pregnant women. C. Dementia patients. Abbey pain scale. Dementia. The Abbey pain scale is typically used to assess pain in patients with dementia who may have difficulty communicating their pain levels. Therefore, the correct answer is C. Dementia patients. 18. What is patient-centered care? A. Caring for patient with dignity and respect. B. Understanding patient's feeling and providing necessary needs accordingly. C. Helping patient to gain insight to her problem. Patient-centered care. Patient-centered care refers to an approach to healthcare that prioritizes the patient's needs, preferences, and values. This involves understanding the patient's perspective and providing care that is tailored to their individual circumstances. Therefore, all of the answer options provided may be considered as elements of patient-centered care. Option A. 19. When assessment an unresponsive patient, what is the appropriate way to get a pain response? A. Sternal rub. B. Nail bed pressure. C. Pinching of the ear. D. A. Trapezium squeezes. Pain response methods. Sternal rub. When assessing an unresponsive patient, the appropriate way to get a pain response is typically to use a sternal rub. A sternal rub is performed by making a fist with one hand and placing the knuckles over the patient's sternum, the area in the middle of the chest. Then, firm pressure is applied and rubbed back and forth. This can be uncomfortable and may cause pain, which can help to elicit a response from an unresponsive patient. 20. A patient suffered from CVA and is now affected with dysphagia. What should not be an indication to this type of patient? A. Place the patient in sitting, upright position during and after eating. B. Water or clear fluid should be given. C. Instruct the patient to use a straw to drink water. D. Review the patient's ability to swallow and note the extent of facial paralysis. Dysphagia CVA management. Instruct the patient to use a straw to drink water should not be an indication for a patient with dysphagia following CVA. Using a straw may increase the risk of aspiration, as it may cause liquids to be taken too quickly or in too large a volume. Therefore, it is not recommended for patients with dysphagia. The answer is C. 21. Prion disease is related to which of the following condition? A. Myocardial infarction. B. Crohn's disease. C. Creutzfeldt-Jakob disease. Prion disease and CJD. C. Creutzfeldt-Jakob disease is related to prion disease. Prion diseases are a group of rare and fatal brain diseases that are caused by an abnormal form of a naturally occurring protein called prion protein. Creutzfeldt-Jakob disease (CJD) is the most common prion disease in humans, which affects the brain and leads to rapid cognitive decline and neurodegeneration. 22. A patient is returning home from hospital. They will spend several weeks in a residential facility, followed by community support. In order to ensure a positive process, what action does a nurse take? A. Allow the patient to arrange any community service to allow them to be independent. B. Give discharge information to the care facility who will liaise with others. C. Copy all agencies into the discharge plan correspondence. D. Ask the patient to contact their general practitioner to follow up on services needed. Home discharge planning. In order to ensure a positive process for a patient returning home from the hospital and spending time in a residential facility followed by community support, the nurse should give discharge information to the care facility who will liaise with other relevant agencies or services. This will help ensure that the patient has a coordinated and comprehensive support plan in place to meet their needs and promote their independence. It is important to involve all relevant parties in the discharge planning process, but it is typically the responsibility of the care facility to coordinate the ongoing care and support for the patient. 23. Before proceeding to explain the care plan to the patient who has hearing loss, what should a nurse ensure? A. Does the patient have working hearing aid? B. The patient is happy to talk. C. Does the patient feel comfortable? Hearing loss care plan. A. Does the patient have working hearing aid? Before explaining the care plan to a patient with hearing loss, a nurse should ensure that the patient has a working hearing aid, or any other assistive device that can help the patient hear better. This will ensure that the patient can hear and understand the care plan being explained to them. Additionally, the nurse should also ensure that the environment is conducive for communication, and that any background noise or distractions are minimized. This will help the patient focus on the conversation and improve their ability to understand and retain the information being shared with them. 24. The doctor is busy with his assessments and asks the nurse to do a procedure that the nurse has never done before. What would be the nurse's best response? A. Ask a senior nurse for help and to supervise procedure. B. Refuse to do it and ask that he get someone else to do. C. Ask a colleague to supervise. D. Do it since it's the doctor's order. Nurse seeks procedure help. Answer is A. Ask a senior nurse for help and to supervise the procedure. As a nurse, it's important to prioritize patient safety, and performing a procedure that the nurse has never done before without proper training or supervision could put the patient at risk. The best response would be to ask for help from a senior nurse who is experienced in the procedure and can supervise the nurse during the process. This will ensure that the procedure is done safely and effectively. Refusing to do it without a valid reason or doing it without supervision can both lead to patient harm and are not recommended. Following the doctor's order alone is not enough in this case, as the nurse also has a duty of care towards the patient. 25. When a patient is discharged from an acute setting, how is the GP informed about their inpatient care? A. Copy of all inpatient notes are sent. B. The GP will phone their hospital to retrieve the information when required. C. The patient is required to make an appointment and brief the doctor. D. Discharge summary is sent. Discharging patient information. The correct answer is D. Discharge summary is sent. When a patient is discharged from an acute setting, the hospital will typically send a discharge summary to the patient's GP. The discharge summary will typically include information about the patient's hospital stay, including their diagnosis, any tests or procedures they underwent, any medications prescribed, and any follow-up care instructions. This information helps the GP to understand what happened during the patient's hospitalization and to provide appropriate ongoing care.